Next, we're going to be talking about migraine headaches and migraine headaches treatments or pharmacologic treatments. So there's going to be a variety of medications, therefore there may have a little bit of variation when it comes to the mechanism of action of the medications, but mainly it involves the nerve pathways and then causing changes that affect blood flow in the brain and the surrounding tissues. So it includes vasodilation of the cranial vessels. It is important to consider some precipitating factors of migraines. One common precipitating factor is stress or emotion. So when somebody's being emotional, somebody's very upset or angry, that can trigger some headaches. In addition, hormone changes and hormone medications such as estrogen can cause some migraine headaches as well as alcohol, cocaine, caffeine, and chocolates. In addition, another common known trigger is MSG or monosodium glutamate, which is used in the food industry, most commonly in the Asian cuisine, and they usually use it to add more flavor to soups and processed meat. So the effect of migraine medications, they stimulate serotonin receptors in the brain, therefore causing vasoconstriction. Serotonin is a chemical that acts as a neurotransmitter that has a wide variety of function in the body. So in this case, it causes vasoconstriction. The effect of migraine medication often is cerebral vasoconstriction. There are some associated symptoms with migraine. That includes photophobia, sensitivity to light, phonophobia, sensitivity to noise, nausea, vomiting, and some patients also report aura. So basically, aura is referred to the changes in vision and sometimes the senses of smell, and they just have this sensation that they're about to have migraine headaches. That's usually prior to the onset of migraines. The duration, it is dependent. It's not always the same, but usually it's somewhere between a few hours to several days, depending on the severity. Treatment for migraines are variable depending on the patient's symptoms and the severity and frequency of migraine attacks. So sometimes treatment include prophylaxis or prevention. Sometimes it's just treated with each occurrence or as needed. Other times they use a combination of treatments. Either can be a combination of prophylaxis and symptomatic treatment. On the prophylaxis, in order to be considered for that, usually patients should have 2 or more headaches per month, and the patient interprets disruption of activities, and acute treatments are ineffective, and often it can cause rebound headaches. In addition, beta blockers that blocks beta receptors in the blood vessels, sometimes calcium channel blockers are used, as well as tricyclic antidepressants and NSAIDs are used as well when it comes to prophylaxis. On the non-pharmacologic treatment, sometimes lifestyle modification can actually help prevent migraine headaches or at least decrease the frequency of attacks, and also avoiding triggers such as, let's say, if somebody knows that caffeine triggers migraines, it is very important to avoid that trigger. For pharmacological treatment for migraines, we have serotonin receptor agonists or the triptans. The ones that you have to remember are the ones with asterisk. So for this specific pharm class, you have to remember Imitrex or somatriptan. It is available in PO, sub-Q, nasal, and it causes vasoconstriction in the large intracranial arteries, therefore helping relieve migraine headaches. There's also ergot alkaloid or the ergots, and the known one is cafergot or ergotamine and caffeine. There's also alpha agonists such as proamotine or midodrine. So this medication is often used for hypotension, but in this case, this can also be used for migraine headaches because this medication causes vasoconstriction. In addition, there's also combination medication such as Fioricet, which is acetaminophen with caffeine and butalbital. Some nursing actions include assessing for signs and symptoms, also patient's history, assess for therapeutic effects and side effects, evaluate for serotonin syndrome, especially for certain agents, and then it is important to make sure that the patient follows up with their provider. In addition, there's a emphasis on educating the patient when to use certain medication and also to remind them of appropriate dose, because sometimes especially if they're having very frequent attacks, they sometimes don't realize how much medication they're taking. So it is very important to make sure that they're taking the right dose and right frequency.